Hello, and I would welcome you to our Dairy XNet educational video. We have a very intriguing and useful topic for you today. This is on the diagnosis and treatment of metritis. Our speaker today will be Dr. Stephen LeBlanc. In this video, you're going to hear from Dr. LeBlanc on various aspects of metritis or uterine infection in dairy cows. Going to discuss some of the contributing factors, lower feed intake, bacterial loads, other stressors, as well as the diagnostic methods. He's also going to cover the impact of metritis and efficacy of some of the available treatment options. Before we get started, I'd like, again, to just direct you to Dairy XNet, your e-extension informational source for dairy information, dairy-related information. We have a number of archived webinars, and we are now starting to provide a number of educational videos, such as the one today. If you'd like to get more information, you can look at the links below and find us on Facebook, on Twitter, or sign up for our newsletter. So to get started here, I'd like to introduce our speaker today. Stephen LeBlanc is a professor in the Department of Population Medicine at the Ontario Veterinary College and research program director in animal production systems at the University of Guelph. He received his bachelor's degree in animal science from McGill University in 1992, and then a doctorate of veterinary medicine in 1997, and then a doctorate of veterinary science in 2001, all from the University of Guelph. Steve practiced veterinary practice for 5 years, and then after that joined the faculty at the University of Guelph, where he teaches veterinary and agricultural students and provides clinical farm services. His research focuses on the transition dairy cow metabolic and reproductive health and management, including field validation of precision technology, such as using BHB meters. With the graduate students and collaborators he's worked with, this work has resulted in over 90 peer-reviewed papers. Certainly, Stephen is well-versed and provides some excellent information, very practical information. Also, another plug I'll put in for some of Steve's activities. Currently, Steve is serving as president of the Dairy Cattle Reproduction Council, and I would encourage any of the listeners to look up DR or DCRC and find more information on reproduction. So with that, I'll go ahead and turn it over to Steve and start our video.
Thanks, Bob, and thanks for the opportunity to share some of this information through Dairy XNet today. So over the next half hour, I'll pull together some strands of data around the definition and diagnosis of metritis, some practical recommendations for treatment that I hope can be the basis of discussion for making plans for your herd involving your herd veterinarian, and also some food for thought about where we may go in the future in refining both diagnosis and treatment of metritis. The disease that we're talking about, again, is systemic illness of fresh dairy cows, typically in the first 10 days to 2 weeks after calving, with a foul-smelling discharge, perhaps with a fever. But what we're talking about here is an overtly ill cow in the early days after calving, as opposed to other forms of reproductive tract disease, such as purulent vaginal discharge or endometritis, which are diagnosed and dealt with more like 1 month after calving. So that's not our discussion topic for today. Producers will be aware that metritis is a common disease and certainly an important disease to the cows that are affected. It's to do with an infection of the uterus, which makes the whole cow sick. But if we ask why do some cows get metritis and others don't, there are some risk factors that are fairly obvious, difficult calving and retained placenta being two of the big ones. But an important point to understand is that, in fact, the roots of metritis go back some distance before that, and that's what the data in this slide convey. So this is an experiment that was done at the University of British Columbia in Canada over 10 years ago now. They followed about 80 cows very closely through the transition period, and what you're looking at here is their feed intake or their dry matter intake from 2 weeks before calving till 3 weeks after. Cows that had both a foul-smelling discharge and a fever are represented by the red line, or severe metritis. Those that had a foul discharge without a fever, or what was called mild metritis, on the yellow line, and those that did not have metritis or any other clinical disease, or the healthy cows, on the blue line. And the things that I would draw your attention to are that obviously at the time of diagnosis of metritis at around a week postpartum, the cows sick with metritis, of course, were eating about half of what the healthy cows were eating. That's not surprising. If we follow them back to around the time of calving, the cows that would later have metritis were already eating less. But one of the most important points here is that, in fact, if you follow this backwards as much as 2 weeks before calving, the cows that would have metritis as much as 3 weeks later were already eating less than their healthy counterparts. And that really underlines the point that there are metabolic changes and likely immune function changes that are being set up and maybe even are in fact present and measurable well before metritis actually happens. So the point is that metritis is not just a disease of a difficult calving, but in fact has its roots going back quite a distance before that. In this particular research, they were interested in the social and behavioral aspects, and one of the things that caused those cows on the red line to eat less was that on average they tended to be more often a socially submissive cow. In other words, a cow that was the loser in a competition at the feed bunk. That's not the whole story, but it's certainly one important piece of it. From that same study at British Columbia, this is looking at data that would represent 1 day from midnight till midnight, and essentially what you're looking at is attendance of cows at the feed bunk through the day. FD represents feed delivery, so they got TMR twice a day, and you can see that, as is typical when fresh feed is delivered, that's rush hour at the feed bunk. Those are when the high peaks occur that cows want to come and eat at those times. Again, the point here is that we know from the previous slide that those cows that ended up with severe metritis had lower net feed intake, and often because they were being displaced or knocked out of the feed bunk by more socially dominant animals. The point here is that those animals did not compensate by shifting their attendance at the feed bunk to off-peak times. So in other words, cows have a very strong drive to eat socially, to go up together to the feed bunk after the TMR mixer wagon drives by. And those who are more socially submissive and end up on the losing end with net lower feed intake don't compensate for that in a way that might be logical to the human mind. They don't shift and eat at other times in order to compensate their total intake. So again, metritis is a disease related heavily to immune function, which is in turn related to the cow's metabolic status, which further in turn is related not exclusively but importantly to cows' feed intake, one determinant of which is their social status. all of which underlines the general point about the importance of feed access for all cows in the close-up and fresh pens, allowing, if you will, for some compensation, some extra space for those more socially submissive animals who are at higher risk of metritis. Again, dairymen and managers will be very familiar with the fact that metritis is undesirable and has undesirable consequences both in the short and the longer term. These are some data from Jose Santos from a few years ago, where they summarized data that they had on transition cow health for a large number of cows in multiple reproductive management trials. But again, it'll be no surprise that cows that lived through a tough calving, metritis, and so on paid a price in terms of a lower proportion pregnant at first insemination than for cows that came through the transition period without any health problems. And so again, on the one hand, their data show that cows that come through the transition period without any health problems really do very well at first service, over 50% pregnancy, whereas those that live through difficulties including metritis have a substantially lower success at first insemination. So again, if we can keep cows healthy, their fundamental fertility, even in high-producing Holstein cows and intensive high-production herds, their fertility can be very good. So all cows suffer from some degree of uterine contamination or infection after calving. The potential pathogens are probably there in many, if not most or nearly all cows. Certainly that can be made worse if cows are assisted, and especially if they're assisted in an unhygienic way. And there's some work, which I'll touch on briefly in a moment, that not all bacteria that may contaminate the uterus are created equal. Some are more specifically virulent or pathogenic for the uterus than others. So that has importance, but probably the greater importance is on the cow's response to the inevitable contamination of her uterus. So does she have a robust immune response? Is she able to have a good inflammatory response that helps clear bacteria, but then turn that back down in a way that's managed and helpful to the cow? And the other metabolic challenges that cows go through around transition in terms of reduced feed intake and hypocalcemia are also elements that feed into how well their immune system will be working and how well they're able to regulate inflammation. This next slide has a lot of data on it, but just the take-home points to pursue this thought on the bacterial side of the balance are that there are in fact some strains of E. coli, which is one of the main uterine contaminants and potential pathogens that you would find in the uterus of cows, in particular the uterus of cows with metritis, in the first week postpartum. And these research groups from the UK and from Cornell University have shown that, as I said earlier, not all E. coli are created equal with respect to metritis. There are some strains that seem to be specifically adapted to be pathogens of the uterus, and those are different E. coli than would cause calf scours or severe clinical mastitis. And to pursue that one step further, the research group at Cornell has now published some work where they developed a vaccine against an experimental vaccine. It's not commercially available yet, but this experimental vaccine included E. coli and some of the other bacteria whose names are listed on the slide that are known to be, or at least are very strongly associated with metritis in the first week postpartum. So essentially they took 3 of the top candidate or most notorious or strongly associated pathogens with metritis and developed a couple of different versions of a vaccine against these bacteria in the hope that that would protect cows against developing metritis. And without going into all the details of it, briefly what they found was that animals that were vaccinated by subcutaneous injection with this combination of these 3 metritis-associated bacteria, vaccination did in fact decrease the incidence of metritis significantly and indeed substantially. So for example, based on daily inspection of the cows by the farm staff, it reduced the incidence of metritis from 28% in the control group to 16% in the animals that had received the vaccine by injection, which in turn improved the reproductive performance of those cows by virtue of reducing the number of them that had metritis. The vaccine didn't have an effect on the later, more subtle forms of reproductive tract disease, but again, this really raises the promise of improved prevention of metritis through specific means with a vaccine. So stay tuned for some further research on that. Another thread of the picture of why and how some cows come to develop metritis, as I alluded to earlier, is immune function. And again, this is a study, excuse me, that was done by Doug Hammond when he was at Utah State over 10 years ago now. And similar to what you saw a few slides ago, we followed about 60 to 80 cows through the transition period from a week before calving till 8 weeks after, and looked at a lot of things, but in this particular slide, a measure of immune function that's specifically relevant to metritis. So the ability of neutrophils, or one of the white blood cells, to not only consume or eat, if you will, bacteria that might be present in the uterus, but to actually kill the bacteria that those white blood cells had ingested. And so what you're seeing here is that, similar to before, cows that had metritis at around 1 week postpartum had worse immune function than the healthy cows at that time, but also had worse immune function prior to that. In this case, around calving, so a week before they became sick, they already had substantially worse immune function than did healthy cows. And one of the reasons that these cows had worse immune function, again, it's certainly not the only reason, but one of the reasons was that those cows that had worse immune function typically, or on average in this study, had worse, or that's to say lower, dry matter intake. They ate less in the 3 weeks before calving than the cows that had better immune function. So again, we're weaving the threads together. Eating less is a risk factor, which contributes to immune function. Immune function directly and indirectly contributes to a higher risk of metritis and worse immune function. One of the other threads that goes into why some cows have metritis and others don't is some work from Florida. In this case, pulling together both the immune function aspect and also hypocalcemia. Again, all cows go through at least some degree of hypocalcemia, low blood calcium, in the days after calving. Again, like with immune function and other aspects of metabolic challenge, it's a question of degree. For some cows, it's mild. For other cows, it's a major challenge. But what this group from Florida showed was that one of the things that contributes to worse immune function is what we'll call subclinical, or perhaps better, suboptimal status with regards to blood calcium in the first 3 days after calving. Specifically, they showed that cows that had moderately low blood calcium concentrations in the first 3 days after calving, that was associated with the risk of metritis. So that's what you're seeing here. In the bottom panel, the cows that developed metritis on average had lower blood calcium, or if you will, suboptimal concentrations of blood calcium relative to the cows that didn't develop metritis. And that makes sense because in addition to contributing to muscle function that people would be familiar with, calcium also has a major role to play inside cells, many cells, but in particular inside immune cells. So it's not surprising that there would be that association. And indeed, that's what the group from Florida showed with this work, was that those cows that had subclinical or perhaps better suboptimal blood calcium concentrations that was associated with their immune function. So both phagocytosis, the ability of neutrophils or white blood cells to eat or consume bacteria, was lower in the lower blood calcium group, and similarly the ability of the white blood cells of those cows to digest what they ate, their oxidative burst of those neutrophils, was also lower in the cows that had lower or suboptimal blood calcium in the first 3 days after calving. So another thread in why is it that some cows have worse immune function and in fact go on to develop metritis relative to, if you will, the cow standing beside them. If we think, shift gears a little bit towards the diagnosis of the condition, the standard or practical definition of metritis, working definition right now, typically is a cow that has a foul-smelling, fetid discharge plus a fever in the first 10 to 14 days postpartum. But if we think about that from a fairly practical standpoint, if a farm takes the temperature of every cow for the first 10 days postpartum, for example, sure enough, you'll typically find a lot of cows that at least on one day or two experience fever, anywhere from 10% to nearly half. But fever alone is not a very good predictor of whether the cow has problems going on with substantial infection in their uterus. In fact, the correlation is quite weak. And so most herds have come around to the idea that fever alone is probably not a good indication to go ahead and treat with antibiotics. So in the case of metritis, we typically say fetid discharge plus fever. But we could equally ask the question, and again, I'll get to that in just a moment, are there cows that maybe don't have a fever that might benefit from antibiotics? Or conversely, should we be more precise or restrictive? Is a single day of fever a reasonable criterion to trigger the antibiotic treatment decision? What should the threshold be? And that's there are reasonable working definitions of that right now, but I guess a point to ponder is that there's still a lot of work that needs to be done for us to be smarter and more refined, more targeted about exactly which cows actually benefit from antibiotic therapy for metritis or metritis-like diseases. So again, all cows have some degree of bacterial contamination after calving, and consequently their immune system needs to kick in to respond to that and clear that bacterial infection. And so one of our working concepts is that the difference between the healthy cow and the one that develops metritis it is perhaps more a question of degree. It's not, yes or no, does she not have a response, but rather how effective is that response and how well regulated is that response. Again, the working definition of metritis is a fetid or foul-smelling discharge, probably reddish brown in color, watery, visible externally on the vulva of the cow, and with an offensive odor, plus fever. And so a group in Germany recently did a study to validate how well people agree. If you had a bunch of people walk behind a group of cows, would they all come to the same conclusions about whether a cow has a fetid discharge or not? And again, it was remarkably detailed. They had a number of vets and final year vet students. They had collected and frozen a bunch of samples of discharge from real cows in these little jars, which they opened up in the room, and got people to score the color because reddish brown is considered one of the criteria, score the smell because fetid or foul smelling is one of the criteria, and score how thick it looked because watery is one of the criteria. And the bottom line of all of this is that given a large group of people, the agreement both of people the consistency of people within themselves to score the same sample in the same way was not bad but not great, and the agreement between two people scoring the same sample, or in theory the same cow, was fair to middling. And so even though our working definition of metritis seems pretty simple and straightforward, in fact its repeatability and precision is not fabulous. even taking a cow's temperature, which should be pretty straightforward, put the thermometer in, read the number, even that there are some things that contribute to variability. Not least is how deeply it's held in and so forth. But over and above that, this same group in Germany found that, for example, heifers or animals that had just calved for the first time typically had a slightly hotter or warmer body temperature, which might perhaps in theory change how you would interpret their temperature. Cows that were ketotic in first lactation also tended to have a higher temperature, and obviously not surprisingly, when it was hot outside and cows were under heat stress conditions, that warmed their whole body temperature, but of course doesn't necessarily mean they actually have metritis. So even these things that seem straightforward are perhaps not quite as straightforward as you might think they are. What does this, if we shift gears here just a little bit to, okay, that we've got our disease, a little bit of thoughtful uncertainty about how we diagnose it, some thoughts around why some cows have it and others don't. Who cares? What does it mean to the cow? Clearly the cows look and are sick at the time they're diagnosed, but what does that mean longer term? So these are data from one of our studies from a number of years ago, where we looked at cows, if we focus on the right side here, that did or didn't have metritis. And not surprisingly, those that did have metritis had lower pregnancy to first service, lower pregnancy by 120 days in milk, and very slightly, not worse pregnancy by 300 days in milk. And their culling risk numerically was always a little higher, but actually not statistically so. And so the point here is that while metritis certainly has undesirable outcomes, as the weeks and months go by out into lactation, really the longer term effects have more to do with, did the cow have her metritis and get over it, versus did she incur other diseases? How did she do in terms of production? And ultimately, is she able to get pregnant? These are data, again, back to a smaller study, in fact, the same study that we saw in the first few slides, where they follow those cows forward through the whole lactation. And the point here is that, not surprisingly, those who had any kind of metritis made less milk than the healthy cows. That's expected. But the cows that had mild metritis, from a production standpoint, actually looked very much like the cows that had severe metritis, particularly among the multiparous animals. So even what we think clinically looks like a milder form of metritis seems to have a similar effect on production to what we think looks like more severe metritis. And from some of our data, again, what we found, similar to what I just showed you, the production effect of metritis actually was very, very small, not statistically different among animals in their first lactation, whereas animals in their second or greater lactation paid a price equal to about 250 kilos or about 600 pounds of milk less for having lived through metritis at the beginning of lactation. And last but not least on that, this theme of production and reproduction effects, but also on what does it mean to be apparently a more mild versus a more severe case. So for example, having only fetid discharge versus fetid discharge plus some degree of fever. This is a study from Argentina, cows in a dry lot with about 300 cases of metritis. And this was a treatment trial where half the cows were assigned to receive injectable antibiotics, ceftiofur or not. They didn't really see a difference in terms of treatment in this study, but the part I actually want to focus on is not so much the treatment as the disease. Again, just to drive home the point, what they saw in terms of pregnancy was that either form of metritis looked very similar in terms of their the milder cases in terms of their fertility actually did not have much of an effect on their reproduction, whereas the more severe cases paid a real price in terms of their fertility or their pregnancy rate. In terms of production or milk yield, it was flipped around. The cows that had either form of metritis paid a price in terms of early lactation production. How common is this? Well, again, these are back to some data from one of our large studies, and as you would expect, cows that had the obvious risk factors at calving, like a difficult calving, twins, or retained placenta, had a high incidence risk of metritis. 28% of those high-risk cows went on to have metritis. But even among cows that didn't have any of those obvious risk factors, so had a problem-free calving, nevertheless, 12% of them still developed metritis if you were looking for it reasonably carefully. And so this is a common disease, and not just of cows that have the obvious risk factors. Which leads to the concept then that sort of ties back to what we presented a few minutes ago, which is that the healthy cow has a robust but very well regulated, prompt, and effective immune and inflammatory response to the contamination of her uterus, and that's what we want. But there can be cows that simply have a delayed, inadequate, too low, too slow kind of immune response, which would lead, here it refers to endometritis, but it would be equally true for metritis. And the third group is one that's a bit of a newer concept, but may also be relevant, and that's cows that have actually switched into a situation of whole body inflammation even before they calve, but in a way that's actually not helpful to the cow. So if we get down to some very practical clinical things, if we have a cow that has this fetid, bad-smelling, red-brown discharge, and you know, if we look at the front of her, she probably has her ears down and isn't eating well, isn't milking well, etc. What can we do for this cow? So there have been a number of good, well-controlled, well-designed, large field studies over the years. And again, I just want to illustrate a couple of points here. There are two studies here which compared using ceftiofur in two different formulations. So one was the daily injection formulation of ceftiofur. The other is the long-acting formulation that's injected at the base of the ear. But what I want to emphasize here, more so than the drug and the treatment per se, is that these two studies, which were quite large, 400 cows and nearly 1,000, all of whom had metritis, they had a negative control group. So they had an antibiotic treatment group and a saline comparison group, so practically a negative control. And their case definition was fetid discharge plus fever, so cure was the absence of fetid discharge and fever. And the notable thing here, and again, this isn't really meant to be specific to the treatment, but rather to treatment in general, is that the cure rate about a week to 9 days after the end of therapy was around 3/4 of the cows, not 100%. And what drove that difference between 75 and 100% was mostly cows that still had a lingering fetid discharge. The fever was almost never a problem. That's resolved with treatment very promptly. And similarly, that even in untreated cows, their ability to survive and indeed resolve the case of metritis is reasonably good, 55 to 62% of cows. Now, that's not to say that those cows don't pay a further price in terms of production, reproduction, and indeed welfare. But the point is that cows will survive the condition. That's not to say that they shouldn't be treated, but also that even with antibiotic treatment, we're still not curing or completely curing all the cases. So there's still some room for improvement in our strategies and tactics around response to metritis. these are data from a very small study in Germany, and again, so they're to be taken with several grains of salt, but the point is that this group looked on a very small scale at essentially a wait and see. So when cows were diagnosed with metritis, they took one group of them and didn't give them antibiotics for several days, and essentially the point of it was that many of those cows did not actually go on to develop a fever or worse clinical outcomes. So this is not for something to be taken home to change your protocols now, but the point is just that if we can get smarter and more refined about the diagnostic criteria, the criteria to select cows to be treated with antibiotics, there may well be some subgroups that are actually not good candidates for antibiotic therapy, that don't particularly benefit from antibiotics. They might benefit from other therapies, but in the long run, we can perhaps become more refined about selecting which animals actually benefit from, or if you will, need therapy with antibiotics. So that's a stay tuned for future developments. Watch this space. If we look at some of the other recent work done on therapy specifically, this is a really nice study, again, out of the group in Florida. So Jose Santos is the senior researcher, and Fabio Lima, this was some of his graduate work. So they enrolled over 500 cases of metritis from a large dairy in Florida. They also had a group of healthy cows that didn't have metritis that they kept as a comparison group. Among those with metritis, they randomized them either to be treated with ampicillin, so Polyflex, or with ceftiofur, so Exenel, each according to at least their label dosages, if not their label indications in the case of Polyflex per se. And so these cows with metritis were randomized to one antibiotic therapy versus the other, and then all the cows, as they went out to the breeding period, went on to a pre-sync, off-sync program for reproductive management. As an interesting aside, sorry if I go back by one here, they kept track of whether the cows had only a fetid discharge or a fetid discharge plus fever, and randomized across those two subgroups of animals. As just an interesting aside, among those who started out only with fetid discharge and not a fever, half of those cows actually developed a fever even though they were on antibiotics, one or the other. A strength of this study is that they not only looked at the clinical cure of the case of metritis, but they followed the cows onward to some other outcomes. So what we're looking at here are clinical cure rates. In the top panel, based only on vaginal discharge, so that's vaginal discharge score less than 5, meaning they no longer had fetid or foul-smelling discharge. In the bottom panel, it's like we've seen a few minutes ago, the cure based on both the absence of fetid discharge and rectal temperature less than 39.5 Celsius or 103.1 Fahrenheit. Again, across the board, there largely were not differences between the two antibiotics in their clinical cure. You can see that the cure rate at day 5 after diagnosis was a little bit different between the ampicillin and ceftiofur, but as time went by, those equalized, and that was equally true for the cure criteria based on both discharge and fever. By 12 days after diagnosis, there was no difference between the two groups. Again, though, the cure rates were only about 67%, not 100%. So there's a population of cows that, despite having had several days of antibiotic therapy, are not fully cured in the sense that they may still have fetid discharge or indeed fever. They followed these cows out and looked at whether they had pus sitting in their reproductive tract at 32 days in milk. And again, there was a difference such that there was a slightly or somewhat lower prevalence of pus in the ampicillin group, but there was no statistical difference in the prevalence of cows with chronic uterine inflammation based on cytology. So in other words, the proportion of cows with endometritis out at 39 days postpartum. And finally, when they followed these cows right out to reproductive performance, so now we have metritis with ampicillin, metritis treated with ceftiofur, or the group of cows, contemporaries from the same farm, that did not have metritis at all. Interestingly, an equal proportion of cows were cyclic, so they had a normal estrus cycle, they had ovulated by 64 days in milk. There was no difference across the three groups. And for pregnancy at first AI coming off of the pre-sync off-sync program, again, no differences in the proportions pregnant between the two metritis treated groups or those relative to the healthy cows that never had metritis in the first place, be that at 30 days after breeding, 60 days after breeding, or obviously the difference with pregnancy losses between those two. None of those were different between treatment groups, and either group or both treatment groups, in fact, were equal to the healthy comparison group. Now, without a negative control group, one can interpret this in one of two ways, or at least two ways. Either these therapies are equally efficacious, and both of them are indeed effective. They bring these cows with metritis back up to a level of fertility that's comparable to cows that never had metritis in the first place. So either one works, and indeed both work. Absent a negative control group, perhaps the more skeptical interpretation is, well, we don't know whether these treatments were better than if the cows had been left alone, which I guess is fair enough. We don't know that for certain, given the lack of a negative control group. But in any case, these animals ended up with comparable reproductive performance. And those outcomes and those responses or apparent responses to treatment were not different whether the cows had only fetal discharge or had both fetal discharge and fever at the time of initial diagnosis. So as we get towards the end here, the question often comes up in organic herds or other herds, what about other potential approaches to therapy other than the use of systemic antibiotics? So there is now a little bit of well-designed and published data on this. So in this particular study, over 200 cases of metritis with the usual definition from an organic herd where use of antibiotics wasn't an option, were assigned to either receive an infusion of iodine in water into the uterus or a commercially available product which is aimed at intrauterine therapy. And they were used once every other day for 3 days, so a total of 3 treatments. None of the cows received any antibiotics, but all of the cows received fluid therapy in the form of intravenous hypertonic saline and dextrose, as well as 5 aspirins a day for several days. The duration wasn't clear in the study. And of course, the reproduction of these cows was managed with tail chalk and estrus detection, not with synchronization. Without going through this line by line, the point is that there were some differences in the clinical outcomes between the two therapies that they looked at here. So they found higher cure rates, lower cull rates among the animals that received the commercial product that was infused intrauterine relative to the iodine infusion at day 6 after diagnosis. That held through for some of the clinical aspects out to day 14 after diagnosis, equally with the proportion of cows that had left the herd by day 6. by day 14 or by day 30. And of those that remained in the herd and went on to reproduction, there was in fact a difference that favored this particular commercial product in terms of the proportion of cows with metritis that ended up pregnant at first insemination, and indeed were pregnant by 150 days in milk or by the end of lactation. In contrast to the previous study, though, you can see that at least just by way of general comparison, there were some differences. The cows that had lived through metritis, a substantially smaller proportion of them ultimately got pregnant, even though they were treated, than their non-metritis comparison group in the same herd. So to summarize all of this, on the one hand, the diagnostic criteria that we use for metritis today, which is fetid discharge and fever, have some issues, some inconsistencies, at least in how they're applied in the field. However, they're reasonable working criteria for now. There's been a pretty good body of research, both in terms of individual studies and a systematic review, or a study of studies, if you will, which concluded that the evidence base for metritis treatment, at least, is reasonably good. And so, while there's still a lot of work to be done to refine our diagnostic and more specifically our criteria for selection of which cows are going to receive antibiotic therapy, as of today, in terms of developing protocols for your herd with your herd veterinarian, a reasonable starting point for the discussion is that cows that have at least 2 of a fever and fetid discharge and or other signs of systemic illness could still defensibly and rationally be treated with approved on-label systemic antibiotics. And there's a good evidence base for ceftiofur, equally for ampicillin. Penicillin, the published evidence is much less robust, but that would be a rational choice as well, potentially, at least for discussion in developing protocols with your herd veterinarian. So to summarize, we have reasonably efficacious approved treatments, but we could expect that to resolve fever in the vast majority of cows, but getting rid of the fetid discharge, less so. And there are data to show that having that fetid discharge alone appears to have some detrimental effects, at least in terms of production, for cows that have lived through a case of metritis. And finally, that we don't need to be paralyzed by indecision today, but should at least have some a view to the future and some thoughtful uncertainty around the fact that we do need to build a better basis, or better evidence base, around which cows with which exact clinical criteria, clinical signs, are good candidates, benefit from the therapies that we have available in terms of the cattle, the welfare of the cattle, the performance of the cattle, farm economics, and ultimately development or prevention of development of antimicrobial resistance as we make thoughtful choices about when and how to use antibiotics to treat food animals. So with that, we're at the end, and I'm pleased to have had the opportunity to share that information with you today.
All right. Well, thank you, Dr. LeBlanc. That was very interesting, very detailed, and I think really good practical information on such a challenging topic. I want to thank everybody for watching our video and hope that you found some useful information to take back to your farm or take back to your clients if you're a veterinarian and deal with this topic of metritis. Remember, you can get more information from our links that were shown for Dairy XNet on Facebook, on Twitter, and also sign up for our newsletter. Thank you very much.